In this episode, I get to interview a urological pelvic reconstructive surgeon. And you might be saying, why are we doing that? Well, this surgeon happens to be a member of the Meehan MD team, and we are so thankful that she's joined us. It's Dr. Melanie Crites-Bachert, and she's also featured in a documentary called What is a Doctor? And this documentary covers gender dysphoria, and she talks about why she stands up and refuses to participate in these reconstructive surgeries. And we also talk about how the community's gathering to make changes. Hello, everyone, and welcome to the podcast today. I am thrilled to introduce you all to, I want to call her my new friend because she is so cool. This is Dr. Melanie Crites-Bachert. I hope I said that right.
Yes, you did.
So just a little background. I just want to say how blessed we have been, since Jim's passing, that this community of medical freedom providers not only is just growing just immensely and day by day, but we are now meeting each other, and just joining forces. And we have been blessed through connections to meet up with Dr. Crites, and she helps us with our practice and as we expand and we reach new patients everywhere. But I wanted to introduce her to all of our patients and friends out in our community, and just let you know a little bit about what she does. And then we're going to talk about the documentary, What is a Doctor? You guys are going to love this. We're going to have a screening in February, and we'll talk about it in a little bit more. But Dr. Crites, if you would just introduce yourself to our audience and let them know who you are and what you do.
Yeah, hi. Well, thanks for this opportunity. So I'm Melanie Crites-Bachert. I'm a little girl originally from West Virginia, born and raised on the farm. So I am the first professional on either side of my family. So when I graduated from medical school, it was actually kind of cool because my mountainous hill people came out of the mountains for my medical school graduation. So it was, that was a really special time. My dad was very, very proud, of that accomplishment because, where I'm from, the best that could be hoped for was, to just graduate from high school. So it was, I was very, very blessed to have, very, very strong-willed parents, and I'm an only child, so I kind of forged my way through medical school, and from there, doors just actually kind of opened for me. I didn't choose my field. I say my field chose me, because I thought I was originally going to go into internal medicine. And actually, God had different plans, and I ended up becoming a urologist. So two entirely different tracks, medicine and surgery, two entirely different tracks. And when I got into urology, I further decided to specialize. Again, it just kind of chose me. Everything just kind of coalesced. And opportunities just kind of started coming out of the woodwork. But I ended up doing a 2-year fellowship in pelvic reconstruction. So I, treat both men and women for common pelvic health concerns, things as as difficult and as complicated as fistulas and stricture disease and reconstructing the urethra, in both men and women. And then for women, I ended up in a practice in Portland, Oregon, where I ended up opening the premier pelvic health center in Portland, Oregon, and was in private practice there for 12 years, where I just basically focused in on female pelvic medicine at that point in time, and treating dropped bladders and reconstructing the pelvis. And because I had such extensive training, I kind of became the go-to person for colleagues to refer patients for complicated pelvic health concerns. So prior surgeries having dealt with mesh, because I am a mesh surgeon and skilled in mesh reconstruction. So I was still performing mesh surgeries back when mesh was, kind of falling out of favor. And, I basically, the guidelines, at that point in time and even now are that if somebody is going to have a mesh augmented surgery, it needs to be by someone who's specially trained to use it and who's specially trained to handle complications should complications arise. And, I am that person. I do have that training. So I became the go-to person for colleagues for that sort of thing. So I took care of a gamut of situations and urinary incontinence, treating it, various different ways, and became very skilled at using the bladder pacemaker. And out of that, I ended up patenting two different techniques, one for implanting and doing trial of the device in the office, and one for implanting the device in the operating room. And then COVID happened, and I kind of saw things were going to go south very quickly. So at that point in time, I had, I think, 5 state licenses because I had kept all of my state licenses from everywhere I had done training. So I had West Virginia, I had New Jersey, where I had done my urology training. I had Florida, from where I had done my fellowship. I had Oregon and Washington. And so I decided, well, I probably ought to make some plans for the future and make sure that I have, all of my options and all of my ducks in a row to be able to provide for my family, because I knew which way I was going to go when COVID hit. I was not going to bow to tyranny. And so I started amassing state licenses and, finally amassed all 50 state licenses in DC. And so that's how we became connected. Because of all of my state licenses, I was able to help the medical freedom fight with providing prescriptions for COVID, and became involved with Gold Care and became the clinical director of Gold Care. And then when you all found yourselves in a time of need, when Dr. Meehan passed, that allowed me the opportunity to use what I have to help you all. And here we are. We've become friends and we've developed a lovely relationship, and our mission continues to grow.
Well, and I always hear this phrase from people. It's like, and then COVID, right? And then COVID. Life was normal. Everything was going great. Patients were coming in, going out, doing my thing, and then COVID. And so
Yes.
it's I always tell people, COVID was a blessing and a curse all at the same time, because just the accumulation and the camaraderie of all of the different, there was always different medical freedom people, spread all around the United States, spread out all around the world. And then COVID, and we all started gathering, and
Yes.
we all started meeting, and we all started talking. And then now we're all starting to create change, and we're all starting to create parallel systems,
Yes.
to the allopathic world. And in that regards, I always say, in the worst tragedies and in the worst outcomes, there's always blessings. God always provides a way. So whether that was COVID, he gave us all of these, opportunities. In Jim's passing, if he knew what was going on today, Trump got in office and we've got Bobby Kennedy going in, and, all of this, I mean, he's just jumping around, I'm sure. But it brings us together, and so that we can help more people, we can educate more people. And along with the education, we're starting to see censorship is actually starting to fade. I believe Mark Zuckerberg actually came out and said he's getting rid of fact checkers. So let's see how that goes. But
Yeah.
I mean, if more power to us if that's actually going to happen. But in that, the hot topics and what's going on and everything else, what I find amazing is that, something like gender dysphoria, which was a small pocket,
Yeah.
is now become this. It's kind of like that squeaky wheel gets the grease. You've got this group, and you've got, the pro people and the anti people. And I always talk about, it's like, so you either call it a transgender surgery or you call it medical mutilation. My deal is, once you turn 18, then you make up your own mind. But we've got, these young children. There's so much controversy behind it. And what I love is that, America's Frontline Doctors produced a documentary called What is a Doctor? And you would be you would be the go-to person for these surgeries, because I'm going to say it, urological pelvic reconstructive surgeon. Everybody say that 10 times fast. You are the go-to for that. And I just really wanted, like I said, we're going to do a screening of the documentary here in Tulsa, Oklahoma in February. And so it'll be at Clay Clark's venue. So you guys are welcome to come. I'll put the details down in the narrative. But Dr. Crites, you play a big part in this documentary. So I really would love for you to give kind of an introduction of how this documentary came about and the part that you play in it. So that would be great.
Thank you. So yeah, it came about. I was approached by Simone Gold of America's Frontline Doctors and Gold Care, particularly because of my expertise and and surrounding this this particular topic. And there aren't, at least that I'm aware of, if they are speaking out, I don't know about it.
Yeah.
I've not heard of any other pelvic reconstructive surgeons with experience, in dealing with these surgeries and complications from these surgeries. I'm not aware of other doctors speaking out about it. Now, there are certainly the surgeons speaking out for it.
Right.
We see that in Matt Walsh's documentary, What is a Woman? And, some of the Daily Caller and Daily Wire documentaries and Epic Times. We will see those people. We'll see the endocrinologists and the pediatricians speaking out against it. But surgeons are kind of this very small group that really haven't come to the forefront. So I was approached by Simone Gold because of the lack of informed consent around the transgender ideology for children. Basically, children can go into a clinic without parental knowledge, without parental consent, can go into places like Planned Parenthood and get puberty blocking drugs, can get sex change drugs. Males can get estrogen, females can get testosterone, voila, quick fix. And all of this without parental consent, without parental knowledge. So when it comes to surgery, informed consent becomes very, very important, not only with these drugs, but with surgery, because surgeries are essentially irreversible. Once you take a healthy, functioning tissue and you refashion it and you remodel it, that's not reconstruction. Reconstruction is taking something that's broken and putting it back together. In the case of gender reassignment surgery, if that's what you want to call it, you are deconstructing very healthy tissue and you are constructing something back that's not normally functioning. When you do that, you can't just go back to what it was before. You can try to then deconstruct it and reconstruct it, meaning if you take a penis and you form a vagina and say 5 years from now, you're sorry you did that and you want to go back, you can deconstruct it and reconstruct it again, but it's never going to be the same. It's never going to function normally. And even those healthy tissues, deconstructing those healthy tissues and forming something different, you're still not going to get 100% functional tissue and 100% functional outcome. And so when Simone approached me, it was about, let's do this documentary and let's specifically talk about the lack of informed consent. And it all came out of the lack of informed consent with COVID and the shots and the not being able to tell people, hey, you know, this is a risk factor, this is a risk factor, this is a risk factor of taking these shots. There really was no good informed consent because we didn't have the knowledge about the shots. Likewise, these puberty blockers, this gender dysphoria that seems to have just erupted in society among children lately, and I say lately, within the last 5 to 7 years, and certainly skyrocketed during COVID. We're giving these children these medications when they're still developing, when they are still building these hormone levels and developing these hormone levels normally. And with puberty blockers, we're stopping these. We are using medications like Lupron that we use for cancer on adults, and we use, you know, in adult men in cancer and we are using these medications on these children with no long-term effects. And that's not informed consent.
It's not. Yeah.
You can't tell these kids this is what's going to happen later on down the road because we don't know. We suspect from what we've seen with adults, but you don't know how these drugs are going to act in children that are still developing. So lack of informed consent. So that's how the documentary, long-winded way of saying that's how the documentary came to be, because of the lack of informed consent. And especially when you get to surgery of children trying to make these decisions. Children, as I say in the documentary, you're presenting these options to children. Hey, let's alter your body permanently. When children, they don't have the life experience. They don't have the wisdom to know what they're consenting to. They've not lived a life of experience, and they've not seen things. We're not teaching coping skills. We are saying, here's a quick fix for the normal adolescent growing pains that you're going through, and we're not giving these children time to develop.
Right, absolutely. Well, and not only that, but you know, I had 5 kids, and it was a natural process. I remember my oldest daughter Allie, who's now 32. She was the biggest tomboy that we had. I mean, she refused to wear girl clothes for a while. She played sports. She was, you know, so athletic. And you look at her now, and she is a mom of 2 kids. She's a girly girl. She's a pig farmer too. But that aside, you know, she's as girly as they get. But it's a phase that you go through, and it's kind of like, you know, I always start with like my grandkids. I'm like, there is a boy. You're either a boy or you're a girl. You can like boys and girl things, but you will always be a boy or a girl. And you've just got to go through life. And you're right. It's like they experience those things. And just because my grandson, who is 2, likes to wear dress up girl pink shoes, that doesn't mean that, oh my gosh, he needs to be a girl. It's like, let's get these kids through these. They're normal, they're growing, they're imaginative, and it's part of life. And you're right, the whole quick fix thing, you know, but there's definitely somebody behind this pushing this agenda, right? So that we can get surgeries, we can have lifetime customers. And I think you know the phrase, do no harm, except if it's going to make you enough money. Not you, but I
choose not to do surgeries. I chose. So back when I did my fellowship, so, you know, I will qualify this in saying I have not done gender reassignment surgeries. I have reconstructed anatomy for situations like cancer. There are times where for a man, if he's got a penile cancer, you have to amputate the penis. You have to, perform surgery to, give him a way to urinate and reconstruct things. I chose not to do gender reassignment surgeries.
Right.
Back in the day when I did my fellowship was the one that you did if you were going to go into those gender reassignment surgeries. If that was the field that you were going to go into, and that was the population of people that you wanted to treat, that's my fellowship is the one that you did, because it encompassed everything pelvic reconstruction. Within the last 6 to 7 years now, fellowships have developed specifically for gender reassignment. And, it encompasses everything from plastic surgery to endocrinology to psychiatry, psychology, those sorts of things.
Yeah.
Excuse me. So I chose not to do those particular procedures, but pelvic reconstructive procedures are very lucrative. And the more surgeries that you do, the more you get paid. And that's exactly what happens in this industry. When you start manipulating hormones, you are creating patients for life. Because when you start manipulating hormones and then you start doing surgeries, for instance, if a female wants to begin looking like a male and living her life like a male, that's multiple surgeries for plastics and cosmetic and mastectomies, and which is known as top surgery. And then you've got the bottom surgeries, which is taking the vagina and forming a penis, penile prosthesis. If a penile prosthesis is used for instance, for that person to be able to have penetrative intercourse, if a penile implant is used, that's a mechanical device. So all or part of that device is going to fail at some point in time and need to be replaced. So at some point in time, there is going to be another surgery down the road. So what we are doing by doing this unnatural manipulation is the pharmaceutical industry and the medical industry are creating patients for life. And these doctors, which I find a lot of the times are not terribly ethical, they're cashing in. I mean, this is big business. This is a hundreds of millions of thousands of dollars of industry. I want to present this data that you can find, there's a database that you can go to find out how many of these surgeries and these particular procedures and hormonal manipulations are being done in your area. It's called stoptheharmdatabase.com. And
Stop the Harm Database?
Stoptheharmdatabase.com.
Okay, we'll put the link in so
yes,
that people
please
can
do.
find it.
Because you can go to your particular area and see what's being done in your particular area. But from 2019 to 2023, nearly 14,000 minors. 14,000 minors. The number is actually 13,900 and something. So, rough estimate, 14,000 minors underwent sex change treatments. So that could be hormonal manipulation or surgeries. 5,700 roughly minors had sex change surgeries. Now, this is between 2019 and 2023.
Okay.
Right around 8,500 minors received puberty blockers and hormonal treatment, and 63,000 individuals, I think it's something like 700 sex change prescriptions were written for minors. Who does that? And why do you do that? And why are we giving this to children when we've not addressed what's actually going on? Because actually the data shows that if you let children go through the natural course of adolescence, 80% of them will desist,
Yeah.
meaning they will stop thinking, oh, I should be a boy or I should be a girl. They will stop, they will work through it. And so we're doing these surgeries and we're giving these prescriptions for things that are psychological in nature, that
Yeah.
we're not giving them the normal coping skills. We're not teaching them how to deal with life. We're teaching them that, oh, here's a quick fix. And it's actually not a quick fix at all. It's actually
No.
creating more problems later on
Yeah.
down the road.
It's creating a patient for life, and
Correct.
that's, yeah, that's got to stop. Well, so because of the awareness of all this, and you as a surgeon, thank you so much for speaking out, really, because I mean that takes a lot. I mean, you get attacked from all sides. Yeah, you are the target. You are the one that they're going to attack. But do you see any hope, any, positive things that are coming about with the awareness of, the exposure of all these doctors that are conducting these types of surgeries, or the way that, these kids are being treated? What do you see coming in the next, couple of years, and how would you like to see this movement go? And
So I am encouraged. States like Texas and Tennessee have taken a very hard stance.
Mhm.
Texas issued a moratorium on, these surgeries and these procedures on minors.
Yes.
There was just a recent the Scrimeti case out of Tennessee that just went to the Supreme Court. We're waiting for that to be ruled on. America's Frontline Doctors actually wrote an amicus brief in support of the Scrimeti case. So I do see some very positive things on the horizon. We've got groups cropping up all over. We've got wonderful, wonderful colleagues in the mental health aspect. My cousin is one of them. She's a mental health counselor, and she feels, very much the same way. So, she sees hope on the horizon with her other mental health colleagues, and, our mental health colleagues in the Association for Mental Health Professionals. They're
Great.
doing some great things as well. Philip Crum and Kathleen Mills, who
Hmm.
are also hosting a viewing of the documentary as well for their mental health colleagues. They have taken a special interest in focusing in on providing mental health care for some of these young individuals. We've got individuals like Dr. Miriam Grossman, who's written numerous books,
Yes. Yeah.
on this, and is very well versed, has treated a number, of these individuals. We've got moms in, a mom in Colorado. There's a very lovely documentary called Art Club about how her child, and she started a group that stopped transgender ideology. Because her child was an at-risk child. Her child was, kind of insecure, and they had moved to a new area. So, was having a hard time making friends. COVID hit. She was isolated from her friends, and she was preyed upon at school under
Yes.
the guise of an art club. And what they had done, the art teacher formed this club and brought in these gender dysphoria specialists that basically in 90 minutes, convinced her child that she needed to be a boy.
Yeah, yeah, there's got to be a stop to that. And it's with people speaking out, creating groups. I always say that, we get the more we see other people speaking out and saying things, the more contagious that courage is. And it's like it's this domino effect. And so, you speak out against it and you say there's very few, or if any, pelvic reconstructive surgeons out there. Well, maybe they're like, oh my gosh, there's one. I align with her. I'm going to speak out against it. I mean, back in the day, when Vaxxed, the documentary came out on the whistleblower from the CDC talking about vaccinations and the MMR vaccine and linked to autism, Jim was one of the very few MD doctors that would speak out against the corruption and the lack of informed consent. And but it creates this snowball effect. You get one person talking about it, and then you get another person, and then it's just like I said, it's encouraging and it's contagious. So
I'm very encouraged with the new administration.
mhm.
Because I know President Trump has taken an interest in this and is stopping this as well. We've got some wonderful things happening. Marjorie Taylor Greene. I was just watching actually a live stream that she did yesterday or the day before, I believe it was. It might have even been this morning. I'm losing track of my days. But I was watching a live stream where she actually got a group together to eliminate the DEI, diversity, equity, and inclusion.
Yeah.
That Nancy Pelosi, that the verbiage that Nancy Pelosi and the other folks that are, I won't say Democrats because it's not one party or another, but that was put in our bills and formed these committees for diversity, equity, and inclusion. Well, anyway, the whole premise of her live stream was that she was not going to vote. She was going to withhold her vote until this verbiage was changed back to family-centric verbiage, because the verbiage was eliminating the word mother, father in favor of birthing parent, and
Right.
instead of saying brother or sister, sibling. Well, no. And so I'm very encouraged because she spoke up, and then she got some of the other legislators to same sort of thing. So courage is contagious. So I'm very encouraged that if we get the information out there, all you have to do is plant a seed, and you don't know how that seed is going to grow, but you need to plant the seed.
Yes.
And
Yep.
people need to speak up, because I always use the idea for myself, and I always remind myself when things get tough, if not me, then who?
Yeah.
And that's what fuels me, because you know what? If I have to be the target, that's fine. I've got broad shoulders. I'm confident in what I'm speaking about. I know that God has my back. So that doesn't matter. If I have to be the target, that's okay, because when you're doing something right, and when you're doing something that's resonating, you're going to be the target.
Yeah, absolutely. Absolutely. And I am so glad that you are so brave and that you are making a difference. And I appreciate you so much.
Thank you. I appreciate you.
And I know that you're going to do great things. I can't wait to have you here in Tulsa, Oklahoma in February. And I will make sure to leave contact information down below so people can reach out to you, and also some links for the stuff that we talked about. And I appreciate you so much, Dr. Crites. Thank you very much.
Thank you for the opportunity to talk about this, and thanks for hosting the viewing of the documentary. I'm very excited about it. We're all very excited about it, and you're right, it does bring us all together. You really don't know the community that you have until until you get out there and you start seeing that you aren't alone, and people, there's always somebody out there that thinks like you do, and there's always a community that you can find. That's what makes this country wonderful. I mean, there's room enough for everyone.
Right. Absolutely. Well, thank you very much. You have a blessed rest of your afternoon,
You
and
as well.
I will be in touch with you.
Yes, ma'am.